Pacho, we are live. Okay, internal mesh link. Okay. All right. Pacho, yeah, best in a program no ase. Yeda obi biara ase se ene so moje emre na ye nyina yeba abesina ade. Yɛbɛma disclaimer kakra say deɛ yɛyɛ yi just educational purposes and also for informational purposes only. Mpacho yɛmba ɛmɛ diagnose anaasɛ yɛmɛ treat obiara. If you have any medical condition, yɛsrɛ sɛ wobɛhu wo doctor na wayɛ nhwehwɛmu na waboa wo ɛwɔ sankwa no so. Enti no ansa na yɛbɛ kasa afa yɛ topic a yɛbɛyɛ no ɛnnɛ no ho no, yɛbɛma yɛ sponsors, yɛbɛda wɔn ase, Jeviado Healthcare. Timpacho ɔmo flyer ɛna ɛwɔ ɛso no, sɛ wohia ɔmo services a wobɛtumi akontakte ɔmo. Afei nso no, de Nancy ɛnso ɔmo flyer na ɛretwa gu no, yɛsrɛ sɛ wowɔ any issue with holistic healthcare, premium supplements, self-order labs, ne nyinaa ɛyɛ available, wobɛtumi akontakte yɛn nso. Afei, ɛnɛ topic a yɛbɛ discuss no ɛyɛ when strength fades. Let's talk about men's health. Month where you're dedicated for men, and you know, sorry, baby, yeah, it's all about men, men's health, everything about men. It's in a yɛbɛ abɛkasa afa mmarima apɔmuden ho. It's in a mefi aseɛ every before I say mefi aseɛ, I may introduce you panelist. It's me started with myself. You're from Dr. Nancy Ampedumi, a licensed naturopathic medical doctor. May practice award Nancy, holistic and integrative care. My friend Dr. Asare na ono so introduce ne ho. Dr. Pacho, why you muted?
I'm your friend, that's it. A friend, Dr. Janet Cranton Asari. Me Juma Ewo UMass Memorial Hospital. Yeah, clinical pharmacist.
Okay, that's it. Dr. Adolfo.
Yo, when you may see the tier for Ninase, and my doctor for Minuna, Ebumo, Edit CCDBA, Muyason, not Mutie, and Patrol, friend, Dr. Margaret Adolfo, me, family medicine, me, a medical doctor, family medicine, and a year, my specialty. Currently, me, Arnett Health, and when you're Kenya, Chuma. That's it.
Yo, a doctor for a kukudam, yeda, when you na ase, say, and you see, we are busy, but much mumre, na yɛn nyinaa yɛba abɛsua adeɛ ɛnɛ. Me sɛ mmerɛ no mɛfrɛ Dr. Asare na waboa yɛn ama yɛanya nteaseɛ. Yɛba yɛn Ghanaian community yeah. How why is it difficult say Ghanaian men ebetimi are talking about sexual health issues? Aden na yɛ den paa say ye Ghana ye community ye womi sexual health as a mema no mo nhyɛ da nka ho asɛm pii mpacho betimi aboa yɛn na yɛate aseɛ. Doctor, why are you muted?
Muting. That's it, Dr. Pedu. You're here for it. I'm on CBM. Yo, that's it, Dr. Pedu. Eba Ghanaian men open up with sexual health. I never be brave and tia a mamo prevent you from doing that and coming up openly about their sexual health. Yedi kind the TV say ya Ghana member no said ya titi ya member no beginning ya chire ya member no say I don't know say penifo we no said ya tie but you say it's me ya no ya member no said ya hu omo no ya hu omo say omo ye a member just say omo person omo di omo member sem like omo ye the head omo nyemre see obema na no dra ya nyon e see utimi gina say obema and it is a ba say or more ahoɔden kɔ fam a just a sign of weakness in our culture. If you buy just a sign of weakness. Tina ya din so be admit say they have that problem because if you say the mema muno a brenasi dakra. And our culture also a taboo. You know who say a mema no actually say your bema it shows that you can you ferry and it's shameful say over bad that just say you try to avoid that open discussion say ebi am I am and I see BB and I say me sexual health and because of ferry number one or feel embarrassed and they go outside if you say a taboo say over openly over out. And it will also almost show say they'll be judged fear of judgment. Into a person will be judged, say, oh, we are Bema and I won't idea of Pomuni say Bema dear, no one say, oh, Bema ya dear, and the chest or your Bema or your kukudam. Into no openly no bar or ferry say, the man must have now your chest or your kukudam no, and no bear form, and into obey avoid it, saying it or talking about it. And also say, oh, catch will be an IBBA. It will be out there, go for far gossip and go for judgment, afraid of judgment. People will judge, say, oh, Bema Yokwe, on your dear. And all of this, almost try say, be prevented from saying it out, say, me emra and as a BB console. And I buy a Ghana system, I had the Yamin child there, medical field, via healthcare environments, we are protected by HIPAA. But a background it's not so much protected, to say, oh, yeah, dear, but it's not like maybe I'll continue become once of a sue. And a Ghana member, especially in Ghana, maybe also be called clinical setting, be a nurse, be who say, I know, hey, Obama, ya nam well, queer, tinting, we, on shed that and ye, into no sound preventing is all be called, I could seek help. Because of ferry, so be be a nurse in nice girl be nam one who say and nunti and our baha, and so a preventive. And I'm more about so no say Yamin child and Kolano Munino, they teach them about sex education. But yeah, traditional Ghanaian, we don't actually come up and teach not parents, and so then almost first on back at your Bema said, Brabetina, and I mean. And no one care about Bema Sem, Mema, I say, that is a problem. They don't educate, and they didn't used to educate a Mema, fathers, we're not educating their kids, quality, there's a gap there. And also, on Philly say, okay, I am going down sexually, I have to go seek help because beginning, won't be a sex to be so secret, like holy and yeah, it's so can't be it's a taboo to go out there. If you say a Ghanaian man, and our Ghanaian society, these are some of the things prevent you from seeking help, talking about sexual health, because men man say what makes them men, the masculinity, form as being a man, it will be lowered into, we try to avoid and not be silent about it.
Yo, Doctor, sorry, yeah, that's a baby. What can be about taboo, especially Ghanaian community in perception about say ebia obema when it comes to sexual health, yeah, that's it. Yeah, be moving on to Dr. Adolfo. Doc, ubetimi train some of the most common types of sexual dysfunction affect Ghana, Maymano.
Yo, that's something you made us say. In this, I will share male sexual dysfunction. The main causes, and I said there are three main ones. I categorize it for sebe maybe I will be whom baby I would jina na and non soon to wait me. I know Dr. Kasa na say wape home. So we'll share sexual dysfunction na number one erectile dysfunction. And secondly, a decreased and as a low libido. And the third, and then so ejaculatory dysfunction. Inti yabe breaking na down na yetimi atiasi. So you can say erectile dysfunction abrofo so brofuma is inability to achieve satisfactory erection in order to have sexual intercourse and I say engage in penetration. Now what about your podcast anymore? Say bema intimi engina supiti. Na untimi any oba enhyiamu and I say en start kra o spark kra ubema no na esi nitrase. Intimi engina so ema untimi any oba enhyiamu eno eye baako. And no erectile dysfunction no and decreased libido and it said unya atenka na usha decreased libido na and no mostly no na because of low testosterone level bema bia ade ma ubema dim e manso wo testosterone but bema ne ma ubema dimu pa hormones nyame nyansemu odi bo mema no ema mema dim se ne ma ye de estrogen no mema de ne testosterone na se wo testosterone no ho eba twema ana se o level no enye acceptable range ana se e wo form pa eno no timi affect se bema unya atenka oba nso so testosterone level ye low abene ye ka mema enti se wo hwe low decrease libido na say wo testosterone level yi ewo from obema bi nso wo ho a ye frɛ bibi hypogonadotropinism na sa hypogonadotropinism yi say wo sexual organs na gonadotropin releasing hormone no and no enye adwuma intimi ensense sa wo testosterone levels see other hormones also play parts and I'm person may come into details and I may use medical terms are a bit confusing and no na de sa decreased libido yi etai eba and I think so wo hwe ejaculatory make I say niema miensa pa na say hwe emema sexual dysfunction how the third one near ejaculatory dysfunction and no to say there are different types delayed ejaculation and premature ejaculation and also be untimi ejaculate kra na delayed ejaculation na etrese oni oba ehyiamu a bema no eche ansa na wo ho etumi aba and I say premature ne say what the task na awai inti ema oba no enso entimi enjoy empemu enije no what the task awai uhutimi sorry de nanso entimi engina so ema agro no enso enche inti we ni ade atitiri pa no ha emema yi say ye ka male sexual dysfunction na me breaking it down enema bebre na etimi contribute and I say a cause sa enema me bodi ejaculatory dysfunction a mature mu delayed and premature ejaculation and now say decreased libido and now say erectile dysfunction. Inti so erectile dysfunction me pa chomo teminka. Okay. Inti me pa cho I think say question now beside me the basi here.
Your doctor, yedasi bebre and it's what church you pre-ejaculatory need yakeka hu no be ho this is one agensam na akoya asem bebre. Into doctor, we dey memo wa church yen eniema ben na etimi betimi lead to sa conditions ya wa catch yen na yenya entiase bia na ye bibia na ya ahwe ye ewo.
Me patrol you me that say intimate so send me can my church the different kinds of and also the different main causes and some of the common causes of male sexual dysfunction no minim say ya church bebre ya bo diabetes ya bo high cholesterol depression and anxiety when munina eye niema etimi affecte niema mekaye e wo mema homosexual healthy ho inti di kind ye behwe normally no say ansana bema ube experience any of these sexual dysfunction no na some of the underlying causes no and as a secondary causes are your title it could be vascular issues now your vascular issues na and no yes ebia sene ya churchum bebre wo hypertension affected with blood vessels untina emoja enam and no say moja na enam inti ni mo no so what they are able to set diabetes already intino and hoaka intini intimi ngina ema moja ne flow through mu bebre enti one of the underlying causes and neurogenic and it's nerves basically so it should be what diabetes a situation no affected whole nerves and bema ansana ubema no ebejina ebedimu ebesipi no moja efa intimu mostly no the most specific organ would the bema my friend corpus cavernosum and non spongy like structure na intini famu emma mojane ekojina mu na ama wo bema no etimi ejina etimi edimu and no say moja no entumi enflow no ye vascular sene mekae and nerves can we say bema bia wo show bema entin so ewo ho enti wo yare bi to say diabetes affect nerves and non so betimi affect ema wo bema no entimi ngina so enye no nko say ebia wo chronic low back pain say usha was spinal cord and na yare bia affected with spinal cord and also innervate a lot of your nerves so usha mema and I say nipe bia nerves innervate and I say ema wase organs no so we your bema wo very mano nerves wo ho mani dimu ye no controlled by spinal no S1 S2 the part of spine nerves no efri hu na abetimi abe affected wase nti obi a wo chronic debia wachi wo ya ana say echi yare no ayewa che na wo any other condition bia betimi affected with nerves betimi as simple as that with thyroid and also timi affected with nerves that you be we are very anxious nini na a part of what nerves etimi affected with nerves emma ubema ni endimi nti maka vascular, neurological, and I will local penal factors. So one kasa ubema no ebia what when ya trauma, what ya shipping, ama ubema no intini nam any mujana tina muja femu any nam no ebia ebu. And I say bia uni your baby shie mu na we nya butere na we ni gidigidi and I say open ding ama ubema na nkasa hono ebia dompene wo mu ne eye so fragile ete chuma enti eno no affected wo penal to say o very manankasa enti eno say ebia ho abatwuma entimi ma bema no entimi njina so ye emma entimi undi empemu agro emma enya wo de sene open no afei so there were a lot of psychogenic factors ebinum to say anxiety ayaka ho asem dida depression ebi a odofo kra woni ne wo ho no ne ho nya wakono anasa aware ni mu no ntokwa we ni na ye niema etimi affect bema emma wadwen engine ye emma moja no entimi enflow enkom afen so eniema etimi so cause prescription drugs obi wo ho a doctor de watu eduro bi so yare bi nti saa nioma we ni na eduro bi wo ho a etimi ekosi decrease libido and decrease testosterone level enti we ni na no emma ubema sem no entimi endim ngina ena asabro alcoholism ya dia eno so etimi affect ubema pa because alcohol enye just liver poison etimi attacking nerves ekosi neuropathy na sa neuropathy se wo de ba potoka semu a yese yentin hu no entin bi ewo nipadua mu kan hu se wo berima no yentin a moja fm na enam very soft na esanso with the spongy like structures meka ho asem no enti eniema bi etimi affect wo nerves etimi affect wo blood vessels no se endi mu a etimi affect wo berima na afei so recreational drugs and also illegal drugs ne bi to say marijuana a bit to say cocaine sa enru boni we ni na no heroin ye niema bi a etimi affect wuntin number 1 etimi so affect wo nerves ti we na ye niema bi a etimi affect bema emma wo berima no endim especially so what about erectile dysfunction niema bobo su ni na nso no to say illegal and I say recreational drugs no and also etimi affect say a bit decrease with testosterone level now testosterone level yi eba form a unya atenka and I say why dream musu enye clear we depressed we anxiety we anxious and niema bi nkoye wa brabomu a ni na no etimi affect ema wo berima no entimi nchina so anase wunya atenka anase ebi a wode tare so na awai obema bi so wo ha se woni oba be hie mu be ya wo ho embada timpacho medi besi he ya
your dog wakasa na very important say mental health aspect now you taking it very seriously dog aka ho asem bebe ba kakra me so meka dia are supporting mental health ne say and we say we talk about anxiety and depression ni nyina ya de betimi contribute to obi ni desire say or ne partner benya empamo enkitahudie afi se ne ho besore ana say ne performance ni nyina ya de mental health ebetimi wadwen no betimi affected ya adwen ye honam yi ni nyina eye adwuma bom nya se ba kote fa ko no ye adwuma na the other one so wo fa ko etini se wo mental health na enko ya etimi affect wo sexual performance stress ya dia e betimi contribute a lot of the time no well we say yeah doctor ye hunkofu bebre majority of the time no ye Uber holistic care, you're very thorough when it comes to these things. Now, as a feminist say, stress and ubisa the most common thing now a cause and baby stress from their spouse and our relationship, which is very unfortunate because obia wanted say that and papa also causes stress and that is like so inconvenient. It's me contributed to so many health issues. Oh, aside that, work stress, family from back home, Ghana for chenwo, hane na betimi affect wo sexual performance when we wa drain to be clear, to be able to function properly, and sana will be mano etimi enya hoden na sorry. Oh, afei insuno bibi wo ha yare your friend schizophrenia, ya dream yare. There was psych doctor. Nyame echade a ye de beba no aba explain about these mental health issues. But also ya idea it may contribute a lot. Uyo bia wo bia to a person's sexual performance. It's a one here piece say obi adwen ho ye hwe na enko ye kakra ye bepe help ama afe inso no trauma ye fe bi PTSD ya dia e betimi affect obi ne sexual performance, especially say adequately see in terms of sexual relation e bia na o ya kwala no obi de ne nsa e kan obi e molested obi rape no ni na ya dia your friend you're categorizing as childhood as adverse experiences. Well, we experience on my year for these enqualaya, they are exposed to these kind of treatment. It's a bit to say abuse, whether physical abuse, emotional abuse, verbal abuse, nina affecting enqualaya. Well, we go our household be or there's so much violence. Papa, papa, bro, mommy, enqualane share every day. Well, it's in a say enqualane no omu sometimes it becomes part of them because that's what they are used to. It's so no the same thing with their partner. It's in a here piece say in our household, send our household one ukruno and answer one or into qua. Yes, say mupe in penny form settle not in front of the kids. Because like I said, in kwalani hua and also betimi affect on mental health, on benyi na contributed to so many yare raw mental health issues raw baby. It's in a your best baby. I feel in so no a member be almost suffer abuse a lot. Ayana yenka ho asem. Yani focus too much on a man when it comes to physical, verbal, and emotional abuse. No? But a man should be almost suffer baby or my worry more in their relationship. It will get to a point where I say a man or camp air man. But because with our culture, no, Dr. Osre, but a very true, a very serious issue. I was say, can't ma and comfortia say some men are suffering in their marriages, in their relationship. It's in a room here say, yes, call in this situation, and I say you find yourself in this situation, seek help, and take in all these emotional abuse, all these verbal abuse. Here it's na and focus much more on a man also mental health. Here. It's a Dr. Adofoma Mensan Brow so Ghana, your very be herbal bitters. Especially Oko Ghana, your commercials are whole baby, herbal bitters, a bema wetting 2 hours, 3 hours. It's and then our person will cover herbal bitters. Nature it's for
Dr. Mpedumeda say, so your bitters now, to be very honest, I'm not very sure the research that has been done. Majority of in the Western world, you used to treaty that male sexual dysfunction. In the boani say a boama mo intia mojane moa. A call will bury manimuno, a mani dilate, a cause vasodilation. It's a majority in a minim say also Dr. Sorry bit me up boamekakra in drono therapy, pharmacokinetics, and pharmacodynamics, and which I say in drono, send ye a sifa a year a juma when you pedianim a sifa. Now, majority of enjoy a nitrates are a cause vasodilation. Inti emma untino emubai eno ena etimi mase emubai na mojani timi flow ya eko bemenimo a bra wankasa wo ho anase unya atenkasa opese woni obada wadwen aye stable no emma etimi gina so pintin na mpacho efa bitters na mean to me enka ehwo asem bebre esanse no krani me nim die about researcher on my year endroimu say a year FDA approved me nim the ingredients name me bom pie na me hope ne say a year ingredients are a boa emma enipa wo untinya moja enemua a call adrimu a call organs nimuno a cause dilation inti say bia sa ingredients what bitters mu no say Enyema etimi ema wuntino moja etimi na mu etimi ema calme bema o down ema uberma sorry painting dia enya me pacho na eye na emom no de mi hu ne wo ye mema ne ho ne se bebre no omu bitters no na omu de nsa na ehye alcohol na alcohol nso nerve killer. Inti ebia na edwo no be ye edwuma but over time no it's answer omode insanation no ensa so kill with nerves no so slowly inti bia bitters no bi wo ho a say bia ufa no se ne esesa wo fa no na ewo ingredients a eboa ema moja no etimi flow eko wuntin eko wo berry mani timi gina ho de a anka megidi se ebeboa pa se waso ahwe na eyema wa nka boni bia eni so anase enye ade bia eye nwanwa anase emboa wo nipedua na emom eniema ye deka ho no se nim sifa ekere bitters no na ye de hye alcohol enonum sa ne de mepacho emboa nti say I think say some of the bitters no say you focus on the ingredients you making sure say you safe and the ingredients need to be wo ho a say ube uyobi na wo fa sa bitters ya me pacho making sure say ufa endro fufuro bia any interactions e bia to say enura meka say eno na eboa ema untin no a dilate majority of them near nitrates into uyobi a ufa blood pressure draw be in the nitrate group and I say Dr. Mao say oh yama nitroglycerin uwo fie na wunya chest pain na wutimi fa nemom so ebiso na ufa bitters bi se oberman ebesipi now so ingredients e womu no se nyame ampata na bia no pa ufa blood pressure dro now so pesa woni wo yiri hyiam nti ukofa bitters eno no ebetimi aye very dangerous and very harmful obi wo ho a oni obe hyiam a obeti yes we muna hwe wewu enu ni na etumi ya de a eha ye mema nkanka ya Africa fo no tipacho mesrese ubefa bitters bia na say anaje wo pen a me patron senke betumi a emfa ensa enka and afen so hwe enura woda so ansa na wafa me da say
you're a doctor that's it, and then before say ye be your program name your research kakra about Ghana for herbal bitters omoton baby because very common o call Ghana now so TVCC we know me person me body but I did research on say ingredients pen omodi those herbal bitters and I actually went on one of their websites to see because now labels in them but into exactly what it is in it. It's in the trying ginger and herbal to help with stamina. Well, it's in those other herbs in a day no more diafra. It's in a said the doctor Adolfo Air Casano. So unim ingredients now, how would you even know say herbs be interacting with a draw when they will Dr. Edewo Atoso. It's a and this is a very popular product. So I'm kind of person will be well, but a very popular product. On draw on their websites ingredients being on what their herbal bitters. It's a was in actually near my year tonom. And as a licensed naturopathic medical doctor, may yes about herbal preparation. Into alcohol, the extract nutrients from especially in a back and as a tree back because an only thing, so you need something strong to extract that. It's only a part of the processor the enyasa ahwode mana ewo be a dria echimono. So it's normal for someone to do the alcohol extraction. But there are Ghana for say and Sambia no modeye. We have special alcohol for those extraction. Depending those properties nutrients and as a constituents who here na ama wetimi enya that benefit no. But say omu nimu yenite no na din so bone e de ebre no. So I just wanted to add that to the okan Afe koso no bibi toxic masculinity. It's ye by yen culture mu ha say Ghana for bebre enye comfortable say on bekwa ko seek counseling and na say therapy. Enti no toxic masculinity meka ho asem kakra. Enti ne eba ye famu abibima mu a ye wo bibi e frɛ no hegemonic norms. We ye norms ana ye dia boye ho chenchen. Enti ne bibi ti say obema ensu. Enti emema and allow emema e momo show emotions and momo nye vulnerable. Enti ne bibi yo mo krampo na no ma suppress omo emotions because say ye be when they say biana or you're weak and I say on your real man. But in Shishimama Yang said that's not the case. That is very far from the case. It's obey much me opinion say way and mea. I was say about basso because say or take it in the health very seriously and seeking help. And what say a commotion, I say your trauma say bia almost feeling weak, especially from a man. Say bia na woka for and I say a partner. E catch or say bia bana kusia my stressed and I say my depressed and I say my anxious. I was so tea no pepamo na webinar was munina mo pe emwana ni na abwa ama relationship no at me akosro. It's no sa enyema we nyina get kampo mu a ema emema no feel ashamed say omo beba forward na oma ka dia home. It's no say obi suppress emotions bebreba it may lead to hypertension and I say MI and I stroke and I different MI myocardial infarction and I say heart attack. In simple terms no. It's no sa enyama nyina ye bottle up your emotions. Stress ye ekuntan crying bebre. Stress say one pay attention to it. When we say we shoulder has say as a pain because you are holding on to those stress no, it may affect you physically. Aside say emotional toll na e deba also no. It's in a here. But you take it very seriously. Now, if you want to ya na obey man, was start to some risky behaviors. Now, if you was start to nom and son, no, I start to smoky because say or some coping mechanisms be at your battle and yamana all go through no. It's a stress say and your bonnet say obey ma obekako seeki help. Say ebiana o untimi and perform or empamu ye. Well, ebiana and pamu good yen and konkanya yes. It's not a bad thing to seek help. It's your partners, so now say or partner what we say biana or stress, anxiety, biana performance, no in koya. I was say we'll stop it blame. Men blame you almost say I then now sorry, I then now you 2 minutes, 3 minutes, and I say 30 seconds. No, and who here P say avoid this blame no one bekasa in a humble way. In so no reinforce non-performance aspects of intimacy. It's in your can and no na a patre say. And yes, say when will be a having sex and quan as a penetration and as a sexual intercourse and quan and yes say intimacy with your partner. If you are touch kasa a de who said you'll be described on your conesifa ne attraction to you. It may be impona ne performance and kind baby. Name kasa de and somehow becano. There are other ways mubeti explore aside penetration itself. It's what are mummy no more shared pleasures. And then na muya ema wanije aside say obe mani be penetrate you. It's way and yama betting I discuss it a bit me abuamo in the interim no before sembeko seek help. It's sometimes a man or yana ye kasana koye jeje baby. It do some way, yeah, said you see for kind because of that toxic masculinity, it may money to me open up. But wo partner no we also encourage no enforce no say aden na won kwaje mwa na watena ho saa na eno ne emboa bebre. You need to encourage your partners, you need to encourage your husbands say don benya opepa no akwa seek help afi enso no se beya just ask say ubetimi aboa ubetimi ni eno nyina akọ counseling ayebia odo ana medofo enyina betimi akwa hu doctor so and so na wetimi aboa ye won no being inclusive into eno ne emma wo enyi obema no ensi nchen say ono nko ana go through that situation no It's in a support system. It's in a when we say we struggle with performance, ni weight, increasing weight, baby. Doctor, the doctor don't focus on hypertension, diabetes. Na was changing the lifestyle, no some baby, no smoky. It's honey, send you betting I work it together. Exercise here, exercise boom, diet no, aduane na change and one way also be no so vegetables ni fruits now they come to be part of the support. So the obey man and fail alone in this situation. I think communication is very important when it comes to these things. It's kasa. Respect a woman, it's an abia stress na wokoma and it's nas and namunkasa abia na trauma bia na or yakwalano or firm 18 a fena pop it up a bar was say when in it's nas and namukasa it's a may man so yes stress say mupe open up abia no yakwala if you went through some trauma sometimes it didn't panya bebre but because say and a mama menka ways because say and kwalano obi molesti and now somebody on sake ka omo kwala so na omo be catch on parents and they shut them off. Well, that is the worst thing you can do to a child because at that moment no omo trustable. You are the only person they could trust to tell you they will be there, they will be taking advantage of them. It will shatter omo apa. And then they insane bebree, but for some people, no, they are never able to come and I say overcome that situation. And also to me, the mental health issues bebree, but it's a very crucial say every relationship, say yeah, mummy no montana say anything that went on between mummy and whether it was trauma, it affected the current relationship now. Motinase, say mummy no mutimi antinase, mum pay a specialist, be a counselor, or yes, specialize in trauma care, and I say informed trauma care. Na on board when no one and settle that aspect, It's a very, very important. It was a quine so. It's moving on to my member, Dr. Asare So Kakora. It's Dr. Asare and Joe Baina sometimes yana and Kofu Fa a bit to me are contributed to whether it being helpful or not, there be a side effect be a bit to me are contributed to that it may mass sexual problems.
Yeah, Dr. Pedro, that's it. So about in rural, there are so many. It will so many types. Just say, what's our problem now? And so what's not so na how be brave. There's so many. There fat any there with Dr. Bet. There's so many. I will go into them and then so that you can see say, and there are help out there and more or what me aboa. The first line usually with Dr. Dobeto Sono, your friend Drobia, your group in a class called phosphodiesterase inhibitor, 5 inhibitor. So a drawing, in a class, a be a woman, and a tablet, and your freebie sildenafil, which is Viagra, your freebie sildenafil, which is Cialis, and your will be Levitra. Many and on. Now, so I drew away to the nidino in the class in it, mokasi phosphodiesterase 5 inhibitor, and it prevented the breakdown of me Kobe Brigo. Me said the last time you call your senior carbro focus here. It's young carbro focus here. Now, so classy a drobia so the doctor Dr. Adolfo Kaya a boa emma emoja a flow into ubema nimu so the bear a mubaya the is a vasodilator I be my na sa a enzyme ya a comfort a friend it's a phosphodiesterase 5 and no yeah enzyme ya a one molecule be more a prevent a emoja a free penis out of your ubema mu if you na a subside erection it is a drawing a inhibit process na and then moja a few bema muno ema obema na relax and I subside I prevented that process but I mean going to details it is a draw way no so no what it does is say enya dia ye ka say ufa ya na obe imagine so there be a man me emoja ni ko ekoye ready wo ho na it works mainly by a stimuli to say what fa draw no ufa e wo say unya bibia be kenya na mana pejality emoja ni dia flow ho all right train nti unya kofie bia wo yire wo ho wo yire be ye bibia na wo be touch no na ye bibi na fe adro no aboa ama erection no aba na aye adwuma na ye be ka say we obema wo ho a che say wo ni problem bia wo hu oba bia ne ho yo akono na obema ne be sorry a wo hia sa adro we this medication is just there ama obi o erectile dysfunction no eboa na hu oba ho ana bibia ye wakono a ebe ma ne ti so ama watimi aye adwuma said it increasing the blood flow to na said me kan me bo sa enro yidi there was time e bi ye adwuma nti e find say over Viagra now doctor do to so 30 to 60 minutes and I ever started I started say be ye adwuma it and started right away nti ne find say wo ne wo yire wo ho say na de metimi aye bibi nti na wakofa baako no I train within 30 to 60 minutes no not just say a drona start yeah juma no it's right there in there na fe wakokika Viagra for example no ni nyina no e time yeah juma it's Viagra for example no e be last be say which is sildenafil no be the generic and brand because baby na you can see twi mu ni Viagra more the generic ni bo bi abema bi as Viagra it's sustaining from 6 to 12 hours. It's you a crime them come I just say until say obani cry ready cry. You have about 6 hours to play around, a drone mojani all right. Obani ready ombre cry, not just say I money tisu now we juma. Now you want another one or why and no be and no dear started the same time frame. No, the onset is on the same time frame. But it's sustaining from 24 to 36 hours, which is Levitra. No, into who corner say, Dr. Khan, which is a friend essentialis. Do know Dr. Khan or Dr. Betty Miachro, which one is better for you? I'm another one, Levitra. No, they're very short time, very 4 to 5 hours. Now, Sadro, he said, vasodilation into there was some side effects to be corresponding to that mechanism of action, which is them flushing, when your headache, be vision changes, but it's not significant to the extent say my own quankofa, except say Dr. Adolfo Kayan, you are taking other medication that contradicts with it. To say nitrate, nitrate a vasodilator. So if you go and take this, you are dilating your blood vessels, a severe hypertension one shot ubetimi ewu nti no eno yebe gina we so advice say we obi na say obi ebe introduce adru an say akodi hu nkomachi obi say and maybe your mommy Viagra J, please don't, because if you have a medical condition it doesn't go with it. If you are funny say chest pain or heart problem and in the case now kwakofa you are going to hurt yourself one show you cry during that process. No, na me amfasa ma untimi nya wonkwa bi ma che say ebe proud. It's available. The help is there. Talk to your healthcare provider. Omo betimi ama obi. Oko Ghana na wo Ghana. Ni bu anya ahibia. You talk to your healthcare provider. Yeah, what hand there. Most insurance covers it. Ghana so the any born shed and say about 20 cities. Now may share say the prices this year. The generic form one pill is about 20 cities to 70 cities. Into Viagra, you have 6 hours to have fun based on say who need contraindication. So you pay your 20 cities, 70 cities, and then you just go and have a little fun. Now you sure not say what's heart problems, it's contraindicated for you to take this phosphodiesterase inhibitor. There are other second line if you are a doctor do better so. And your friend in track or tell that Dr. Ampedu, no, that was Dr. Adolfo mentioned the process, the pen is described very nicely. From the intravenosa, a self-injection. I don't know, you talk to your healthcare provider now. It's very well tolerated. You're mixing it all the time. And no, they use a little needle or doctor. If you want a draw back one, I draw mix and mix together. It's no doctor our office on how to do it or how to inject it. It's not hard at all. You try all the time. It's just a little needle, very thin, fine needle. You inject it at the side of where when you are ready to have sex. And it's not. It doesn't have that much of a side effect, but just like most of the time is the injection site, now if you are some kind of bruises and stuff like that. But it's very well tolerated. Many people go in and then get it. And it lasts only for like an hour. It's funny say so and you're ready, you can inject that because within 1 hour, then there was a jumano as a cost. And I walk back on your friend intrauterine medicine and also a yibia that share increase blood flow to the penis in the side, and also a applicator BI that share inside the tip of your penis to help get erection. And juma it starts within 10 minutes. Now within 30 to 60 minutes, not just say also starting juma. It's not too bad of a side effect. It's just a little burning because with the insect it's just a little bit uncomfortable there, but it's not too bad. And about could be a vacuum. So there's so many options. But could be a vacuum. Provide the share the tip of your and increasing blood flow. A trimboja eba Emma erection. Na what you mean? There's so many. But say bibia a failure. Now there's nothing else to do. There's something called penile implant. Our doctor ebetimi a share ubemamu. I don't want to go into details, but it's surgically and also all these are born tougher. They're more into it, but you mean go more into details. But what we're gonna say is that there's help. First line fail, the second line. Second line, second line and become injection. It's very, very common nowadays. You just go, they mix it up for you with the coffee. Healthcare provider teaches you how to inject it. Into ready and now very ready now who said atmosphere is right. You just inject it and then you go ahead. So don't stay there. Don't be be hard on yourself. There's always help available for you. And today there are some how you mix it with testosterone, replacement therapy. In combination therapy. Phosphodiazepine, Viagra, and let me go from the big terms. The Viagra need be plus testosterone therapy. The amount and also doctor the amount. There are help out there. If you are invasive, if you are droning your oral, you don't want oral. There's other ones that I mentioned, and there's also psychosexual therapy, which is also there. And also because dream, the mind and and psychosexual therapists and also they have a way of, and Dr. Pedu, she can say more because that's our area. They can be able to kind of like talk to your brain and stuff so that your brain can work with the blood to increase blood flow down there. So there's so many help available. So talk to your healthcare provider. And then, and I said that now, Dr. Pedu I also did a little research, and Dr. Adolfo, I did a little research about that alternative medicine, herbal medicine as well. And of course, so that we couldn't find any active ingredient to actually look into it to say, this is good for you or safe and effective. So, we go with safety and efficacy. And we combine both to help patients get better and feel better and be themselves. So that's it.
Yo, Dr. Sorry, that's it, baby. It's in a way they made 12 last statements now making so. It's kind of risk associated with unregulated herbal remedies. It's in a way they It's in a buy in herbal remedies now. It's a me study and hookah crown. I was here, actually, yeah, over US has say, Food and Drug Administration or almost regulated supplements, almost regulated any herbal products. Ain't as a wash a year, I'm sure say these claims and as statements are not approved by the FDA and as a Food and Drug Administration. We say, okay, it's in a patch say, obi betimi asori wɔ ne kitchen and I say in the backyard, I make supplements and I say herbal remedies. Edi aba online aba beton without any regulation, without any safety measures. What US has say Ghana is a little bit different because we be FDA approved. I'm not sure whether they actually do it or not. But US has say because of your audience, majority of you what has say now will focus on a regulation. Because say FDA ain't regulating any herbal supplement, and I say any herbal remedies, like I said, it's very dangerous to be buying supplements anywhere. It's in a TikTok shop, on Amazon, yes, on Amazon, Walmart online, all those big merchants online. No, it's not a safe place to buy supplements. Reason being that, say, there's no regulatory measure on those merchandise and as a companies, they just go in, if you have a product, bring it, one or two things, go through, whether say yes certified for safety, qualified, all those issues, they don't address that. It's in there. So yeah, very, very careful, baby. I want to supplements and herbal remedies, if we because of those counterfeits. I feel so yeah, will be a friend botanical adulteration. And on a patch say a biana yemfane say a droppy or why you roots and I said root cancer roots it didn't 18 yeah yɛde no na medicinal properties in ɛwɔ but because manufacturer no ɛpɛ mfasoɔ bebree and as ingredients ɛwɔ mu kakra no nti no more de ne leaves afra mahu enti no mpempie no ebia na ne leaves no ɛwɔ some nneɛma bi constituents bi wɔ mu a ɛbɛtumi affect wɔ liver and as wɔ kidneys. Well, but they're not paying attention to that. It is almost the same money in a no more capsule, no more tincture, no more those supplements, no matter. Well, it's also very, very careful with the supplements that you buy. Well, it's dinasi we have supplements available. Your physician grade premium supplements. And no, we go directly through manufacturers, through a company, I'm ensure that there's a third-party testing to make sure that products normally buy out is safe. Well, it's what you be to say certified GMP and I say consumer lab approved. Well, and yes, sir, or say it be a non-GMO verified and I say USD organic and no penalty. That does not say anything with regards to say I didn't know economy is safe and I say any safe. Well, it's because they are not these FDA regulations, they do other third-party testing to make sure the product is safe. It's not per supplements that just go through our website and then you can buy it. They will discount baby while with me at every hole. I feel in there are some products, majority of the time, the supplements and herbal products, almost yet no proprietary blend. Send majority of the time a proprietary blend. Internet patch say company no and no access to ingredients now on no internet mobile mature say and say and ye no be a copy. But US has saying even with proprietary blend they list the ingredients. Ghana for they don't do that. Well, you don't really know what you're taking. It's a banner said they make kind of sexual products there's a particular ingredient yohimbi. It's nisa yohimbi so one year actually na doctor only obia or into that field air director on how to take it out. It can cause severe anxiety, it can cause panic attack. A bit may lead to hypertension. So when you pay attention to the dose and how much you're taking now. I'm emphasizing on this because the majority of the products, sexual stamina, libido, sex drive, it can be. It's also actually on those products now. We already mentioned about medication interactions with betting happen due to these products. Now, unfortunately, for some of them, they don't even tell you what it's in. Well, it's moving on. What are some of the lifestyle things? And Niyama Baina, ubetimi asisa to make sure say you don't even get there in the first place. Name will get there and Niyama Baina ubetimi change. What are some lifestyle things that you can do? It's a business obedi when we eat ye very important when we try the bebrebe no carbohydrate dense food bebrebe no intine mono bebrebe fufu bebrebe carbohydrate part no and they contributed to so many chronic issues. Diabetes is one of them. One cholesterol no try the bebrebe no and so enye well, we eat ye did the vegetables bebree near the fruits akahona protein carbohydrates na ye kakrebi. You have to be very careful with those health influencers out there, no, because usually they talk generally. Well, it's not personalized. It's just be careful about the whole dieting process. Now go for the to out there, baby. Exercise is very important. When I was so born among Dr. Adolfo explaining the baby when we did diabetes, where did you glucose and I say blood sugar and sugar na time mojanim movie na a movie called tissues ni baby I was called properly it's what's a sedentary lifestyle when you exercise and no say call a juma no befi na babe dana was juma no movement at all now a bit me affected it's get some movement move. I feel so weight they are very important. When we healthy weight is very important. It reduces the risk of so many conditions, hypertension, diabetes, cholesterol, hormonal issues, maintaining good weight are very important. When first na yekase obi ma na fu adoa no yes obi ma wo ska bebre ba cho enye no kre well we ska but it's in pacho I was here ashe ye bia na wo yare bi doctor was on what na say ehwe won ti pacho exercise na ehu hia weight ne so ehu hia say maintaining good weight I face mental health ya ka bebre wo GMRE vacation enye de bia na abekọ adwuma you will pay time off for a reason take that off go on vacation relax with your partner wo enye picture transem Enya fena me kosra akosia ama over vacation and enjoy the moment, be in vacation mode. By the time I waba back, no, obadena are reset, obadena are you ready to go back to work. Well, and we are very, very important. I feel I can't smoke any alcohol, baby. I was here sa any man so. It's where the doctor Adolfo member who suffer diabetes, hypertension. How important is this? Say, what's your choir screening into the annual physical and wellness check? No, here.
Yo, Pacho Dr. Pirimida say, and just to be more transparent, and yet a yariwa diabetes, any hypertension, and any chronic illness. And there are also like autoimmune conditions. Nini na to me affected Obema. Timpachon, I just wanted to clarify that. Yes, a very important. Yaribia or chronic health issue bia affected with blood vessels. Sanya mekain untina muja enemumu eko a flow call will brain and our rest of organs wo unipedua nimno. Se nini na ehon te choma. And also etimi be affected obema enti say iwo hwe yare wanina obi wo ho a yare no wo deda na me kan autoimmune conditions obi wo like lupus nini na yare wa wo body attack sa autoimmune woni pedua wo body cells ne attacking its own cells and no enye yare bia wona wo de untimi control it to say diabetes and hypertension and high cholesterol and no yariwa and no they're modifiable meaning say one kasa no betimi control sa yarewe but yare bi wo ho na abebo untimi control nti ennonom na ye stress say especially diabetes and hypertension high cholesterol sa nyama nina ye modifiable risk a wobetimi aye hu bibi inti mepacho yes very very important so wobetimi a control especially so diabetes well sugar level no at least a acceptable range anywhere below 7 wobetimi keep A1C below 7 and I say impo blood glucose level no wobetimi keeping between like 100 and 140 and also ebeboa living normal lifestyle and and cause a lot of organ damage and affect organs it is all blood vessels no bebre cholesterol so eka ho nti saa yare wani na ne ne ma ya kan utimi control e beboa na mpacho na me pese me ka bibi kakran so fa me ka other neurogenic nearman so especially mema itimi affect oberima unse normally no mild accidents ya na yemfa ya dwen koso ebia na wonam no bi de car ebebo wachi unya whiplash bibia etimi affected was spinal cord no over time so one pan sha eno nso etimi di wonya kan hu se neurogenic cause na mema nso so mema ade ba ko anya me de chem prostate so o prostate problems are me paucho very important say o annual visit no na me kan abesi annual wellness be me bia aha o insurance uko wellness yen charge you copay because there's a reason for that. Inti very very important so annual visit no obey it because be may be wo na ne bema edimu pa ejina so otimi di empemu agroma ekokoten now so ebia wanya prostate esan se onye ne annual wellness inti no onko emma ne doctor en check ne PSA obema bia especially yenya before African Americans and I say obema bia wo ye tuntum kane no nanka udi 40 na o doctor o call for wellness visitor or checki o prostate enzymes and I say bebre no kra starte checki testosterone levels so kona ka say o problem enti wo annual visits no very important it's and say no na wo diabetes o doctor behu o blood pressure ye higher and so behu and I say wo cholesterol numbers and I say yarewa bi ewiewia ne ho aba wo nipadua ma ohu impo ufa eduro bi krapo na se eduro no agree with wa o labs ebetimi ama eyi ne ho di ntimpacho eno nso very very important na mepacho mepese meka ade so kakra minim se no nya question na obisa me ba mebo ne tofa efa Dr. Janet Nroa o churchere na de mepese meka ne se mepacho nti na ye churchere mu no sexual and male sexual dysfunction who yare who dear a how esan say ni enro bebre na ye de ma ema wo be ma edimu no eno ye se ebeboa with the erectile dysfunction aspect so wo hu entimi sorry nemom se bia wo yo bia wo low testosterone eno no so kofa Viagra na emboa wo that aspect because can who say your testosterone level no ene yellow inti se wo hu no na wo ne wo doctor kan obetimi ama wanya testosterone therapy obi wo ho nso a say ejaculatory dysfunction say wo the task na why and now uboso kra intimi ma no different wo ho to say eduro bi wo ho a SSRI to say paroxetine ye you see say we bema e bia wo de tare so na awai na emom no hu timi sorry bema bia ade a ebemu wo hu say me wo problem pa ne say ahomache bema bia nyame ye say ahomache bia wo esese obema sorry now so wo ebia wo hu say ahomache kra unya nocturnal erection and now early morning erection say enter hu akan hu say wo ye nya problem etimpacho ehono doctor na enini endin komo na emom hunia how say yese hu na intimi sorry say yese wunya atenka ana say wuta so na awai ana woni bem obahie ma ebeche hu krapo anhwe ya na ama say hu ne hawa na wo doctor nso behu specific treatment or de bema ana say psychogenic and I say awarimu niema enko yie inti oba buafu bema buafu saa nioma no inti hu yare a eno nso ene ebetimi ama wo ho so moa medase
You doctor, that's a kakra made de beka de all can I say wellness visits a very, very important. At least once a year be a call no doctor entinase. No one be solve questions. No, yeah, well, questionnaire. I should I ma check it for erectile dysfunction, check it for prostate health. Your labs are you running aside the questions. It's in your stress system, no, especially Chrome has say, US has say, we have all that available, specifically to address men's issue. It's in part of way any ferry, any BB, and moi and our quacope, ama wapomodin ako and kind. It's yes, rebbe, said J. Emre, Nina, a can't say, wapomodin ebeko and kind. Yes, say, Dr. Amwa Bessie, when you ya, and I say, wo shoulder, and I say, which your young cotin, Abequaco doctor. We so no enye ferry homa wo doctor emboa wo wasa ekwan no eso etimi pa cho doctor Asare de ma member ho kakra emre kwenti no se ebano social media ebano pornographic things are a mema replace and etc. How does that influence a mema sexual health?
The thing is, say, who get used to those things, the you're sure your body will be dependent on it. So this time you'll be like pono ni idea na o share na o ye o timine o ye compom ni idea. I better there be no one yaswa pono na you will not be able to function. You be advice you said stay away from those things. And and there might be what I said and they can't say and your penetration there are so many other toys sabi pamwa grow mutimi use enti say wunya dear ewo pamwa na so bema nya now it's not only penetration, the affection, the intimacy, the hugging, the cuddling, now something else that you can have say say all these options, it's not an option. You don't men ferry, get something to help you in bed and all this kind of cuddling and all that stuff, a bit but pono ni idea no dear also discourage you from from that. I mean, a bit more hard, they said that's what they like, they want to do it, but psychologically, you will be dependent on it solely. So when as time goes on, it may how be brave in that aspect.
Your doc, that's a baby. Kakra me so me de beka when say, it was here, say those scenes, they are actors. And sometimes they are paid to do all of that. It's not in a realistic world. It's not in the real world. It's in a understand your person or partner a perform it to say the obey and home video and that's be my it's not real. It's that expectations, a bit to me, the relationship itself, and I say marriage, kasa emu, a favorite may lead to addiction. Now, if you are losing interest, it may be go apart. Through this, they can masturbate to the extent, say, more problem, but still, you cannot stop. If you went through that stage now, you need help. It's was seeking psychological help. Now, counselor, no me a boawo, now it me address those issues. No, I think so. Social media, I was here to say, and Kofu I pretended on the social media. It is never their real life. It's we can say not all that glitters is gold. And me assure say we so many examples as to how people can fake their lifestyle and social media. It's never say say so much comparison. They will know they one they were done some no and our dema. And yes, say we any brave na a joa kuno and I say why kosio kuno to be car man into also a tintina or force ukuno money to be mount patrol. Those are not the realities of life. Internet was you take it away from those fake lifestyle, no unrealistic behavior now people portray out there. No, if people are they are just influencers, that's how they get their money. It's, you know, and what's it who pay too much attention to what people are doing to compare that to what you have. It be quite idea one even better than the almost portray or outside. It's just cameras and lights. Once the camera and lights goes off, you never know what's going on behind the scenes. I was seeing pay attention to that. I feel testosterone, yeah, for market a lot for muscles, for energy, for stamina. But I was so yeah, actually, if you are bringing any exogenous hormone, a patch say hormone now, but then natural and you know produce it. But if we outside now, the baby come it was so yeah, actually, make sure say what doctor is on board to direct you. Testosterone a controlled substance. It was so making sure say won't call market baby and fetchy and koye kululubia and kunyada products. It is controlled for a reason. It's kakra mede beka ehono. It's not doctors where the doctor adofumeba also kakra. Eba yen and sorry mu ebi oha na wo call mosque and I say ebi no kwa sorry. But in general, no, what can the church, what can the people who attend mosque, what can they do? Leaders, community leaders, what can they do to help to make sure say a main man also a sexual education, a main man also being provided the help that they need in our churches, say the enkonye a be a man and virtuous woman who
Yo, Dr. Mpedumida say, and I think say Dr. Asari di kind ho kakra. So when you ya ukuhu doctor, and I say, you okay, so Beka Truby say, many meya and I mechie meya intimipacho boame. Minim de intia say a bisexual, and I say a ba ye bury ma and I ye ba ye love, and I say sexual health, ye Pharisee beka home. Say you be open and near many nurses, who should be a uko internet so cra, while me a gugu etro. Into day tina as I say, ye ferry home. Into the best and say, ye encourage ye society leaders. Say a ye mosque, say sorry, any organization, not ye very open about it. To know uko can your background, not come very mal. And I say, and Pemu, and I say, Pemu agro sema, yes, so ya shall we in Kankao your bar, no bar, or no niji and Pemu agro on one she ya na ye lebo, nini na kahun ti debiani she shell. Me pacho enye ferry say uwo o partner, and now your bar worry for Obema wawari o yere, and I saw bar worry wukuna. Ferry be ni hu, and I say impomote, na my yesa worry for, ferry be ni hu. Send beya yini na se sa or hawi se ye ni sa ferry na free mudia ya na eye din se obi wo sa how ne kra obeka training nua e na send ye educate ebia obi wo ho a ehihye ne ho onimpo se obetimi enya help na nso empire ye bone se nyame adi nimdie ya ma yen na wo hwe yen na wo so wo hye unua bi so tia enye ne ferry obeka se se we kra ya ade a impo ye Ghana for kra ye opener ye kasa efa ho nti ebe encourage ye society leaders ne say sexual health very important say ye timika diabetes any other chronic illnesses no sexual health and so as important that's say
your dog me da say wede me fa kakra enka ho ya na sorry some sexual health and but I think so now the church and then mosque leaders they are being open about these teachings to into programs now more they come Sunday sorry one once in a while the more fast specialists and to come and educate the church members when we to do a more obi here and wabi now obetimi reach out to them after those programs when it's na calling no ebia sexual sex therapy ebia marriage counseling and if that is not part of your calling that's why Yankopon the gift ama obiano. That's why we have Dr. Adolfo, we have Dr. Asare here. You practice it very differently, but always together. We are there for a reason. or member no or go through a process and as a situation be you cannot handle what your stress cell or refer on to the specialist omuhia no omunya da help no and paibo here, but yes stress say let's do the needful when it comes to certain things like this too. And yes, so for and so patcho and also very I see a lot of ministers, to be honest. Very in name so be kwakoje emwa. Intini bibi ye wa yesre entina ho ema no enkwadrewo. Come and seek help. We are open. We will help you. Said the Dr. Sarah Kano, HIPAA compliant. Yenya afin ye do business. No, we swear an oath to be able to help you and provide you with the health that you need. Come and see us for us to provide the help. And I say we have so many doctors available. I'll be to me, I reach out to based on the insurance that you have, only insurance as well. We have so many direct primary care services available and very affordable. I'll be to me, I call no more to me, Abuawo. Where the men say doctors, yeah, wrap it up, I don't know. Again, I'm betting me aka in summary, no, more last words and brana, yen say Diana Q&A be or why yet me address it before we leave. Dr. Asare, Mr. TFA, what's up?
Yo, that's it. You better catch your tear for saying, try to break the silence. Don't keep it to yourself. So we'll call sa TB anymore. Say you can, talk to your healthcare provider. Now, in pen be na call and doctor what not says our problem no call for the annual checkup. They don't speak up on can because of ferry. Your best stress say, doctor or doctor or for a reason. Be open, be sano, and I catch no say, Ebian saying, me bemamu a form. Now or no through that your annual visit, no ultimate access so no the reason why Ubema no unya premature ejaculation, the unya ED, unya when erectile dysfunction, on training in them, no say what is the underlying causes yes, your best don't feel shy. Talk to your doctor. They are there to listen and to help you. Main and not them and your na and how that depression and funny home and machine. Yes, sir. Seek help when you need it. Break the silence. It's a medical condition. If you don't keep it to yourself, talk to your healthcare provider. They will listen. That's it.
You, Dr. Sorry, that's a baby. Dr. Adolfo.
Yo, that's something me say. Senior in Dr. Asaria Kano, sexual health and so a very important. Very being name say our rear ebesoa nini nanso ejina senior partners with communication a kusifa say a buffon kitten ye be trasso and majority of times no yana me money will problem because yani if ye mano ukunu ya wadie kitwe bia na wa tight wako jeans man mfane hon kan into overtime ebemane lucy ne sex drive emma ninya enije bia kra ewo ho na afei so minim say Dr. Asare are wrapping it up na me pese me de ade ba kun so especially ye mema no me bringing it to your attention the ntia na ye stressy about enjoy ya enye approved so person obema mu ye den no ubetimi so anya condition bi ase nyame ampatawa ediowo ne bebro eno ne peer prison so wakofa eduro bi na obema ne ebegina so saa afei de yari mahwe bi pen enya ahongo na bema na obre yi esan so kofa bibia na ense so ofa na ne bema ne gina so 24 hours na hwe se ema wodi aba mi oba doctor ho na se me ye na ebrase etimpacho ne ye kini na ne ye bo koko ye nim se ye pese utimi di agromu mpa na wanije na waware so na emanso etimi bem na emom se nyame amboa na wankohfa eduro bi a enye approved a eno nso ehun sunsanso ebetimi abo eno ne peer praise me 2 year bema na bia wo de ohunu agina so ache eko hours 2 mefa say 4 embra from me pacho could seek immediate medical attention. Pacho Medase.
You, Dr. Adolfo, that's a big way. And a very important point I will bring it up. No, no, who here, because yes, sometimes no more fun doing this and akoye nsɛm pii nti yɛsrɛ paa sɛ wobɛyɛ ahwɛyie wɔ those herbal remedies no na wankɔfa asɛm amba anaasɛ condition bi ambrɛ wɔ akyire no nti no kakra a membɛka de afoa because sɛ yɛrapi up no mepatwɛ wowɔ comment bi a wobɛtumi de ato comment section hɔ na yɛreadi ama wo. So far I do not see any nti no mɛkɔ so a akasa who hia pa say ye timi ema yen sex life no very appetizing. Well, 18 obi wo hɔ a omo bedroom anase empa omo dia wo mo manyina no na still after 10 years 20 years omo kusu that the same empa so ebe yes say once in a while over 3 years 5 years it's very important say obesisa the mattress, the sheets, the beddings, sometimes, decorations in the rooms, the lighting in the rooms, bring in and refreshes the whole process for you. It's in a book here said, the same way I was spending time to cook, the same way you should spend time to make the area, very attractive for both of you to enjoy that moment, very, very important. It's yes, say a memane and man, na what of flowers, and ye meman quano ne was a lot of flowers, and manos obetimato diama obey mano. We can do so many things. It doesn't have to be a very expensive thing. Kitswa kakra, it helps spice up the relationship, it helps rekindle the relationship. Last week, you're talking about sister brothers, Pacho. When it comes to marriage, there's no sister brother. And that should be it. If it gets to a point where, say, romance, intimacy, go and seek help, find a sex therapist, go to your medical doctor, primary care, and refer, so we need baby, very, very important. Intimi Pacho, set your wrap it up, I was see a day sponsors as baby. But your doctors, before we move on to to the sponsors, sorry, more will be Bia Mobeka a chat to Anna.
Yes, that I me person me can say, yeah, cheer for booty, Rebecca Chum say. Obi because employment bebree ebinom community am wo mu ebinom de tumi de aduro yi bi a ye ka ho asem tumi de bra mi say oh obi de ama me say me ntra odwen ho say ye best bebree say me emfa obi aduro say obi de aduro bra say ade me fa ye no e ma me be ma mu ye din a ye best say me emfa because minim stories bi a obi akofa bi a or di empamu agra say one timi enwie kra mpo anya nije nti ye best because unnim say medical condition be anase wo aduro bi say di kan nti ye best do not nya only for this aduro be bra bi tell hu na amode be kire be Viagra. That's why I always mention Viagra e your community mu nti ye best do not take anybody's medicine including this sexual be ma mo ayedin nti enu na me di be jamo da ma say.
Okay, Dr. Adolfo, do you have anything to add before say Ebeko sponsors Nana?
Yo mpacho de kan ye de tie phone na se afin so ye bom kokko se se bema obema entimi ntija ensore se ne ye kan testosterone ni na hawa enye ferie kwa ni na ne se outcho obesity appropriate health. Say you ferry with Dr. Kra say you can do a lot of visual visits. Amazon ewo visual and ni panu kwa bia wonnim no obetimi akati the journess so boawa obetimi aboa. There is a lot of telehealth resources. The biana ofere say kawasem enche obia oyega nani na to kasa ubetimi so ayesa telehealthy se upese uhu yen doctor ampedua ono a won firm ono so ebetimi aboa o sa so ye for asene doctor ampedu kai no ye take Hippocratic oath and part of it ne say and somehow only with patients in the becano and say obi for 40 ubetimi esi wo ho nti ye hye mo say so obeka wasem ekire yen anase doctor B anase Ghana ni doctor can who say omfa wasem enkoto abonten na wetimi enyamoa uhia medase
Doctor for nyame enhwa mo bebre nyame enhwa mo bebre and etiefo ne ahwefo ye beda ye sponsors ase Jeviado Healthcare omo provide home care services in yesre se obe contact omo information na echego ewo screen so no se ohia omo mo a yesre se obe contact omo afi enso no di Nancy said any come was holistic care, very personalized, internet when you generalized services. Yeah, share wo the order buy and provide services. You're very integrative. Internet, yeah, share baby. We look at all angles. Said any make your premium supplements. Internet, she baby our supplements and all herbal remedies every. A fair pet labs sometimes maybe I know insurance and cover maybe I know doctor you're having issues supplements and soft order labs throughout the US or US baby I'll be to me order supplements and also be to me soft order labs Enti no ehase ena yedemu ebesi ene eda obi biara ase afei enso no doctor adofo ne Dr. Asare Nyankopo enhwa mo bebre mo semoje emre we are very busy to be honest but say yina ya che emre edi sa program ye ebre mo yesese Nyankopon enhwa mo anam bebre etiefo ti di kan ye no se muni ho a ye ni ho ye damase bebre we don't take you for granted. It's in a yes, say because no maso ye muka cry, no ma like it, no ma share, no ma follow yen real health talk with the doctor's page. You will Facebook, you will YouTube, and when you now be to me, I share yen everywhere. Yedamo asibebre, it's a hase and I demo ABC. Nyankopo Emma Adepa and Chie. Maybe I will be a good night.
Good night. Bye-bye.
Bye.